Well, this is so timely. We were so pleased to see that just as this group was formed, the senator expressed her support to this bill. So it's a great opportunity for us to be able to share some of the growth and success that we're seeing through this program. With that, I'm going to take a minute here. If there's anybody who is new to the group and would like to introduce themselves, please do enter your name in the chat and I'll make sure to acknowledge you there. I know we have a few groups, a few FQs who have joined recently, and I'll name them. If you happen to be on from these groups, please do raise your hand or share in the chat. So since our last call, we've had Altura, Aria, and Tulare Family Wellness join us. So we're so glad to see more clinics jump on board. They're in process of rolling out, and we'll see these clinics go live in the next couple of months. So here's our list of FQs and practices, primary care practices who are involved in submitting e-consults across the 4 counties. We have our e-consult platform vendors on too. Arista MD, ConfirmEd, and Rubicon MD are on the call with us today too. In addition, we are so glad to have such great support from our IPAs. So CCIPA, LaSalle, and Sante, if you're on, thanks for joining us also. And of course, this wouldn't happen without support from Anthem Blue Cross, CalViva, and HealthNet. So we do have our leaders on, and I'm sure that they'll speak throughout the call. And I do have a quick little list of those who've just joined us. Jennifer Doist, I'm not sure if I'm saying your name correctly. Would you like to introduce yourself? And you might be on mute, Jennifer.
Sorry about that. My name is Jennifer Dice, and I'm a director of operations for medical offices with Adventist Health, physician network, and also medical offices. My area of responsibility is mostly in the Hanford, California area.
Great, thanks, Jennifer. And I think what we need to do is add you to this list too, because I believe we've seen a few e-consults come through from Adventist. So that's my fault. I need to add you to this list here. And Michael Solomon, would you like to introduce yourself?
Thank you. Yes, my name is Michael Solomon. I'm also a director of operations for several medical offices at Adventist Health, like Jennifer. And I have sites that are located in Kern County, Tulare County, and a few in Kings County as well. So glad to be on this call.
Thanks so much, Michael. We have a new member from Valley Health Team, Marina Diaz. Thank you so much for joining us, Marina. You guys have been great participants in our last few calls, so thanks for joining. Anyone else, if you would like to announce yourself via chat, we can take a moment and introduce you throughout our call today. Just want to take a moment here. I'm not sure if anyone from Anthem, CalViva, or HealthNet would like to say a word about what they've seen to date in terms of just program sponsorship and vision for the program. Karina, I'm not sure if you want to say anything just on the progress you've seen to date.
Yeah, this is Karina. Hello, everyone. Thanks for joining the coalition call today. So far, you know, we've been obtaining a utilization report from ConfirmEd to see how many e-consults have been submitted from each organization, and what we're currently working on is building a dashboard so that we can, you know, link how many e-consults are done at each health center and evaluate outcomes. So we are working on that. The first step we plan to do with our e-consult dashboard is look at the diagnoses that we have on the utilization report from ConfirmEd and seeing how many are resulting in non-face-to-face, so meaning, you know, they're able to handle the referral with an e-consult. So we're taking those diagnoses and running a high utilizer ER utilization report to compare and identify members that would be suitable for an e-consult that have an existing referral out. So that is coming soon. We are making progress on that. So hopefully we'll have more to share on that within the coming months.
Thanks, Karina.
So of course, you know, the more e-consults we can get, the better, so we can evaluate that data. But yeah, thank you.
Great. Thank you so much. And on the note of evaluation, Karina, we're pleased to have a couple of different studies that will be taking place as part of this program. We have a UC Berkeley student, Jackie Wilson, who is on our call today, who will be taking a look at the success of our program and the impact of payer engagement on getting clinics up and running. And in addition, Delphine Tuel from UCSF is here to advise us and to help us with the data gathered, as she has been an advisor as part of the PRIME program and looking at eConsult data over the past 5 years or more. So what we've done is taken best practices of how these programs have worked over the years to build what we would hope to see as targets for our program. And if you've been on this call, these are not new to you. Those who are new to the call, we would really like to just start thinking of eConsult as the first step for routine, non-urgent, non-procedural referrals. So your primary care teams can look at each referral as a potential eConsult. And then through working through the referral team and through the eConsult process, it can be determined whether that referral goes as an eConsult or a face-to-face visit. And so through this, we're just hoping that all primary care providers in your organizations will have access to this, since it's now available to all of your Medi-Cal patients across the 4 counties that we're working with. We heard from Anthem. I want to give just a note that we do have Calviva on, Greg Hund, Jeffrey Nkansa. I'm not sure if you're on, Jeffrey, but Greg, Jeffrey, any comments that you'd like to make about our targets and vision for the program? And Greg, you might be on mute.
Yeah, yeah. I'm more excited than I was originally, because I think where we're at with our experience with COVID over the last year, it makes the opportunity for eConsults more of a focus for providers and patients. They're more used to this kind of engagement that maybe they weren't in the past. So we're pretty excited about that. We also wanted to let Libby know that things have changed in our grant process, and we are committed to go ahead and support this effort financially going forward. So we hadn't been able to announce that until now, so just wanted to share it.
Thank you so much, Greg. And a good number of our clinics are appreciative of the grant support that they've gotten to be able to participate in this program. So thank you so much for doing that. I don't believe we have Dee Dee. I think Dee Dee may be out today. Dee Dee Iverson and Mark Schweier are part of our HealthNet team. If you're on, you can please speak up, but I don't think I see you on the list today. So we appreciate HealthNet support in this effort too. So as we start to see these eConsults come through, we know that we have a couple of clinics up and running in Fresno and in our other surrounding counties. A couple of the clinics have been doing eConsults in other counties for perhaps a year now, but we're looking at our newly adopting clinics, and we'll be announcing the volume and taking a look at volume per specialty over the next couple of months. So it'll be exciting to see. So with that, we want to announce we're glad to see a couple of clinics up and running. We know that Camarena Health, we know Clinica Sierra Vista and Family Healthcare Network have begun sending eConsults. And we asked the clinics who are active and launched and who are now actively sending primary care consults to take a look at their experience to date. I know Dr. Joel Ramirez has shared a good amount of his experience and his advice as to launching a program over our past couple of calls. I don't think that Dr. Ramirez is on today. And Lenore, I'm not sure if you're on, if you want to speak to this slide. And Lenore, if you're not on, I'll speak to it for you. So we've asked our clinics to do a quick snapshot of their experience, and this is just going to be helpful to us to be able to really profile and share what this looks like. What does this look like in a primary care practice? So it was great to see this first example from Camarena. We'll ask this of each of the FQs participating. So it was helpful to hear and to validate that those specialties that we're seeing a backlog are reported back from the clinic in the same way. So obviously endocrine neurology have a backlog, and they're also effectively addressed through eConsult. Cameron is pretty familiar with this process and has provided some great examples of how to implement. What we want to know from you all is what tools our coalition can provide to the primary care practices to be able to better support eConsult. Is it patient communications? Is it provider communications? CME, we'll talk about in a little bit here. What we're seeing already is what Camarena asked for here is to shorten the time frame from a request to be able to get PCP advice from a specialist. So I think we're seeing less than 48-hour turnaround at this point, maybe even 24-hour average turnaround from a primary care provider asking and receiving that advice from a specialist. What we think is going to be so great to see as part of our program is provider stories, even patient stories, if we can get down to that level. This is the kind of information we'd like to be able to share with Senator Caballero and others as we show the value of eConsult. So I think this is really interesting here, taking a look at Dr. Ramirez's story, looking to see that perhaps initially the primary care provider thought there would be one course of treatment, and through specialist advice, it changed that course. So it's helpful to have that advice without having to have that face-to-face visit to get that advice. We'd love to have more of these examples. And I think next week, Clinica Sierra Vista and Valley Health team have volunteered to provide us their examples. So thanks so much for sharing these stories with us. Because Dr. Ramirez is on, I'm not going to take questions, but of course, if you have any questions for him, I can convey them to him over email. And with that, we want to talk a little bit about what we are planning for March. We have a specialist opportunity set up. We are engaging in the process of engaging specialists to be able to share experiences. We have a good number of specialists as part of our group advising us, and over time talking about the best strategies that they have in terms of responding to eConsults. So what we've done is set up a CME course. We're in partnership with Weitzman Institute and Darren Anderson's team. We're going to be offering CME in March to those who are interested. And this isn't limited just to specialist providers. We will offer this also to primary care providers who'd like to engage in the conversation. So if your group, if your clinic or specialty practice would like to be able to engage in this, we welcome you to reach out, and we can get either an individual session if you have a group and you'd like to set one up for your actual organization, that's great. Or if you have individuals who'd like to just join in an existing session, we can do that too. So we'd be happy to set those up for you. And in addition, we'd like to be able to outreach in the way that's best for you. So as a primary care practice, if you are an FQ and want to be able to connect to specialty partners, we can do that for you. Make sure that they know that this is an opportunity to connect through eConsult. And we have some nice materials for you to be able to share too, just to convey those benefits to specialists. We can offer examples of eConsults, talk about how we are already seeing an impact on regional health, and we want to be able to share that over time and show that how this program is improving access to care. Obviously, this has been a theme of our call today. eConsults are reimbursable for the specialists. We're working on that for the primary care provider side. For specialists, we are seeing that this takes, an eConsult takes less than 10 minutes typically to respond. And we see less, or we're seeing from 25 to 50% of avoided unnecessary visits. So that's exciting to see. So there's some pretty significant value that we can see for our specialists. And so we've had a few specialist orgs join our past couple of calls, and Steve Cade, Valley Children's ChildNet, I'm not sure if you want to share some perspectives on what you've heard to date or what your organization has discussed around eConsult.
Yeah, we're very excited. We've had a number of conversations internally about it. There's a good response from the physicians. Obviously, this is, they want to see, the specialists want to see the kids, in our case, it's kids, but those that are most in need. So if anything they can do to utilize their time to avoid what some might consider an unnecessary referral is very appealing to them. So they're excited to be able to do that, as well as I mentioned earlier, the participation in CMEs, because there's certainly an educational component that can be provided to a primary care physician that gives them a greater comfort level, knowing that in addition to the eConsult, they've got some of the tools or treatment guidelines or protocols that can help them have the confidence in what they're doing moving forward. So yeah, we're excited to be part of it. We're a large organization, so we have to have a number of meetings with a number of stakeholders to advance things, but we're moving through it and we're excited to be part of it. Appreciate the involvement.
Great. Well, it's great to have you involved, Steve. I'm going to hand it over to the ConfirmEd team briefly to talk a little bit about the specialist experience in responding. And Dr. Anderson, I'm not sure, are you on?
Yes, I am, Libby. Sorry, it took me a second to get off mute.
No problem. I'm going to bring up a case example, and if you wouldn't mind just speaking briefly about just your perspective in terms of what makes a good response, as I bring up an example of case that we saw come up in one of our e-consults for the Central Valley.
Yeah, it's great. No, thank you for sharing that example. It's a great one. It's hot off the press. We just received it, and I think we have a pretty robust process for assessing and evaluating the quality of an e-consult response. And I say to our teams and our specialists all the time, you know, we're not necessarily, we're not just looking for specialists who are good specialists in their field. Being a good specialist and being a good e-consult responder don't always necessarily go together. And so we're really looking for a specialist that's a good communicator, that is able to take and translate their knowledge and their recommendations and expertise into something that's useful and applicable to a primary care provider and actionable. And so when we review a typical consult, we look for basic things first. You know, did they turn it around in 24 or 48 hours the most? We look at whether they recommended a face-to-face or not, and whether you know, they a primary care provider would feel comfortable with those recommendations. But I think most importantly, we look for specific recommendations. I think a general consult that says, well, you could do this, you could do that, not as helpful as I recommend X, Y, and Z. The other thing that I think is particularly important is, given that the recommendations are being sent to practices, many of which are in very resource limited settings, is that the specialist is aware of that fact, and that they, when they can, provide contingencies. So you could try this medication, but if this is unavailable or unaffordable, here's some other options. And we, you know, a lot of our specialists will provide a contingency plan if the initial plan that they recommend isn't achievable. And I think, you know, this is a really good example of exactly how e-consults are supposed to work. The one thing I will point out, we really encourage primary care users to put in a good question and to sort of say what it is that you're expecting, that you're looking for from the specialist, and when possible, to explain a little bit about your thinking. This consult didn't really have that one. The chest pain ECG shows no abnormalities. You can kind of infer from that what the PCP is asking. But again, characteristic of a good e-consult response is the specialist went into the note, went into the additional data and information that was provided to them, and was able to provide good, useful information. And then lastly, whether or not they provide good, some educational links, practice guidelines, things like that when appropriate. We look to see that there's some attempt, not just to say do this and do this, but also to provide some education so that the provider can learn from that.
Thanks, Dr. Anderson. And I had to click over. I did not send out this example by email today. So those of you who are looking at the version I sent via email, I just want to be cognizant that I don't want to be sending cases around via email, even if they don't have patient information in them. So I'm only sharing my screen. So Dr. Anderson, I think what was interesting about this for me as a non-clinician is I looked at it and immediately I looked to the end where it was helpful to see, I don't feel as though an in-person cardiology consultation is necessary. Do you have any examples of how you like to structure a response to make it most easily read or easily understood by a primary care provider?
Yeah, so we have kind of a standard response template, and this cardiologist has her own that she uses, which I think works really well. But yeah, I mean, we have a template where they indicate, first of all, discussion of the case, discussion of differential, followed by specific recommendations, and then a section that as this one does, explicitly states whether they feel a face-to-face is needed or not. We want to have absolute clarity on that point. Sometimes they'll say, I would try these things first, and if they don't work, then a face-to-face is needed. But we really want to get clarity on that, because that's one of the metrics that we track in aggregate to help at least get some sense of what your ROI is by looking at the number of very clearly avoided face-to-face visits you're getting from the consult.
Thank you. And I'm going to invite Mary Ann McGuire to comment in too, because we talked about this case yesterday. And although the question may not have been formed in the most clear way, at least the primary care provider did provide the EKG and noted that it did not show abnormalities. So it did help that at least that test was included and that there wasn't a back and forth, right? It didn't require as much of a back and forth as if there was incomplete information from the primary care provider. But Mary Ann, did you want to elaborate on that?
Yeah, I think that's a really important part for this. And when we set up our work with our practice sites, they have some particular at the referral side, just some really general, easy guidelines to utilize when they're submitting the referral question. And cardiology is one, is definitely include the EKG so that the e-consultant who's a cardiologist can use that. And we monitor for that on our side to make sure it's part of the referral when needed as well. And that really allows our cardiology e-consultants to answer the question. And then at times they can really dive into the chart. They get a few medical record dates to look at and some history. And in the progress notes, they're able to, and they're trained to look in there for more defining parts of the question as well that might be in there. And we tell our specialists all the time, many of our practices that we're supporting with e-consults are, they're areas that really have access issues. Time and the number of patients they're seeing has to be done quickly. So please, look in the progress notes for the clinical question as well. And the specialists really, respond well to that. And you can see that right here. It was just done wonderfully by this cardiologist.
Thanks, Marianne. Do we have any questions? Anyone on the call today? We have a good number of primary care groups on the call. Do you have any questions about how do you construct that effective e-consult? Any comments or questions from our group? With that, if you'd like to use the chat, you can feel free to pipe in with questions. But what I wanted to note is this will be the format and sort of the theme or topic of the CME course that we're putting together. So we're putting together a continuing medical education course in March, and this will be part of the curriculum, is how to construct effective questions, how to construct effective responses. And we're pleased to have expert e-consult responders to be the faculty for this event. And this will be an hour. We're calling it a lunch and learn to make it easier for providers to be able to get away and just eat their lunch while they listen in. So this opportunity is available as CME. If there are those who are interested in just staff continuing education rather than CME, please do let us know. We can construct a course that is around referral team management, make it geared to staff and not clinicians, if that is of interest to folks too. Any questions? Okay. With that, I just covered my slide. I'm going back to it again, but please do let me know if you're interested in that CME. And we want to talk a little bit about what we're envisioning for our group for the year, and we'd love some comments from you all. So as a coalition, we meet on a monthly basis. We send, as you all know, we have bulletins that come out via email to give you updates on what's happening with regard to events and resources that are available to you all. We want to be able to share publications that are recent and show data around e-consult. But we'd also like to hear which tools would be effective and helpful for you all to be able to share through these calls. These could be education tools, they could be policy updates, anything that's going to be helpful for you as a group and as a Central Valley Coalition. So we are hopeful that we can be helpful in engaging your FQ and referral partners. As we discussed today in terms of state policy, we do want to provide you updates as these issues progress. We'd love to hear your perspectives on e-consult's policy support and reimbursement or any challenges that you're facing. And with that, we want to talk a little bit more, hopefully in the next month or so, in terms of how these policies can be incorporated into your workflow. We know that the whole billing process can be challenging, especially with the new CPT code. We do want to note that you as a group are really showing leadership. This is a unique model. The fact that you as multiple FQs, we have now 9 FQs, if not more, who are involved in this group. The fact that we have 4 payers involved discussing what's happening across multiple counties is very unique. It's hard to get everybody to get on one call together, so we appreciate your time in that sense. And the data gathering process is something we'll be excited to be able to share with you all, to be able to produce for your leadership and show how progress is being made. And through that, we hope to take every one of these calls and talk a little bit about what lessons you're learning. So we'll look forward to hearing those individual snapshots from the clinics. So I'll take a moment if anyone would like to either share via chat, or you can unmute yourself to talk a little bit about what you'd like to see in terms of tools or resources out of this group. And I had one comment come in saying, we would also like to hear from you all if there are others that we should be engaging in this group that have not yet been invited. We have looked, and this group has been growing from your referral partners. We've been hearing from you all who you'd like to be able to reach to and engage in this group. We were happy to have Mary Renner from Central Valley Health Network speak to other clinics who wanted to be engaged. And through that, we got to speak at the Central Valley Health Network recent roundtable about this program. So if you have events that are happening with your partners that are within your community, we'd love to be able to speak about this program too. Okay, well, with that, I know it's a quiet group today. We want to be able to use our website to be able to get the word out about things that are happening, just like this bill. We have our e-consult bill, State Bill 365, that Michelle Canellis reported today. We'd love to be able to collect your letters of support. As I mentioned, I'm going to go back to that slide here. But if you do have any stories, any case studies, any examples of the successes you're seeing, we'd love to be able to feature them on our website too. So you can see here where our Central Valley Health Network website, we initially started as Fresno. You can tell our link is still Fresno, but we are the Central Valley E-Consult Coalition now. So please do share anything that you'd like us to be able to post to our website. But with that, I'm going to step back a minute. I noted here that we have our link to the bill language and fact sheet. I know many of you may not have had a chance to read it quite yet, but I do want to open up for questions just with regard to that bill language. Blue Path Health worked with Michelle to be able to write up the fact sheet and document the language appropriately to represent the workflow of eConsult. So are there any questions about the bill that we could take back to the senator, or that we need to noodle on around your processes and how to incorporate eConsult billing into the FQ workflow? This might be a topic for one of our future calls. As with PPS rates in the FQ setting, it's probably a new idea billing for an eConsult encounter. So we do want to be able to think about how that might impact you, how it might change your workflows. Any questions or comments on that?
I think, Libby, this is to me, that the intent for this bill is to kind of lift the restrictive language that for some reason DHCS decided to include in its communications out to FQHCs about the use of eConsults. You know, they say that eConsults can be readily adopted, but yet that FQHCs may not bill for them. And in some cases, you know, that we hear that FQHCs would like to be able to have parity with other provider groups, and then decide how best to be able to reconcile the billing at the end of the year. So that's really the intent there. You know, I think this is a really important step in our, as Michelle discussed, as a missing piece to the puzzle of being able to get eConsult to adoption and at scale in California. So, you know, it'd be great to hear level of support and how we might be able to work with other trade associations. We have the eConsult work group where I think this will be discussed this month, but are there other local groups, local coalitions that we should be making sure that are aware that this is legislation this session? And how do we use this group to do so?
So I'm going to call out a clinic who's been doing this for a while and just ask for if you have any thoughts on how we'd incorporate this into your workflow. So Matt Miller, I know that you're on and you're on mute. I'm not sure if you're in a place that you can comment, but do you see any challenges in incorporating, if this were passed, incorporating in a CPT code for eConsult billing on the primary care side? And Matt, I know you're on mute.
Yeah, and I think, Libby, the question that I would have, if I can qualify that, is not necessarily like do we need to change workflow? It's more about the ability for FQHCs to have the option to decide to work with the MCO and do that billing, or at least encountering of the e-consult.
Well, we've taken some time to work with our advisors who have incorporated this into San Francisco and LA programs, so large e-consult programs that have been around for 5 years or more, and we're working to tackle these issues. So we welcome you to join. If you'd like to hear more about this, if you'd like to think about the operationalizing of this over time, we'd like to engage in that conversation. So it might take some time to think about. If there are any questions or challenges that we can help address, we'd like to be able to do that too. So with that, I'm just going to take a moment to offer our plan sponsors an opportunity to sort of share what they're seeing to date. Any other comments that you'd like to share? I'm not sure if you're on, Karina, still anything that you'd like to share in closing?
Yeah, I would just, like to voice that if there is, if any of the FQHCs are gathering any information from the patients that are, benefiting from the e-consult, we'd really like to hear, feedback on that to see if we can incorporate that into that support letter for the bill that is trying to be passed to support FQHCs for PCPs to bill for the e-consults. So, also if you guys are doing any education to your members to let them know, or to your patients to let them know that you are all going to be submitting an e-consult, if that would be helpful for, Libby and I to create some type of, quick like FAQ or information fact sheet that we can, have in your guys' offices for members, while they're waiting for their appointment, they can view it, see what an e-consult is, and if they have a referral in place, maybe they can suggest themselves, and ask their PCP to submit, for an e-consult if they are waiting for a long time before they're sitting in on an e-consult. So, yeah, that's the only thing I have to add, just to hear how the FQHCs are engaging the patients on this and informing them. So, thank you.
Great, thanks, Karina. I know Joel just joined. If there's anything you'd like to share, Joel, and how we are seeing this move forward, any comments that you have as we wrap up?
No, I'm good. Thanks so much. I appreciate you guys running this.
Great. Okay, what I will do is I'll make sure to send you the electronic letter of support link. If you're able to talk to your organization, it's a simple ask. You can sign on your organization's behalf. We are capturing your organization logos to be able to submit one letter on behalf of the e-consult work group. So no work on your part other than clicking the link and responding that you are willing to support the bill if your organization is able to do so. So we thank you for considering this, and we'll resend all of these links so you can take a look and socialize among your groups. And with that, I think we're going to wrap up a little early. We look forward to seeing you next month. Our tentative date for our next meeting is March 17th. In your newsletter that you received earlier this week, if you'd like to join us on next week's e-consult work group call that is also on your calendars, that is our national group addressing e-consult rollout at the national level. And the topic of next week's group is looking at e-consult in response and its effectiveness in addressing COVID-19, which of course we are well aware that this is, that our clinic participants, our clinic providers and staff are right in the midst of vaccine rollout and testing. So we appreciate how busy you all are. So thank you for your time today. And we'll get that letter of support out to you in your email inbox. Thank you for your help and have a great day.
Thank you, everyone. Bye-bye.